This is my presentation on worldwide COVID behavior. I am Ann Ginsberg, a Dow High senior student. My advisors are Dr. Leela Rakesh and Dr. Valerie Ginsberg. This project summary is the utilization of models in order to predict the behavior of COVID-19 in 5 predetermined countries was used to approximate policy and judge mitigation efforts. The 2 research questions were: how does the United States rate of testing compare to other countries, as well as how does the United States mitigating actions compare to other countries? The impact of mitigating actions is based on R over R null charts, where R is the infection rate based on 7-day averages of new cases from mid-March until mid-June, and R null is the initial infection rate around the end of March. The extrapolation of R null will be discussed later in this project. The SARE model, or the susceptible, exposed, infected, recovered model, yields 2 simplified recursive equations. The cumulative infections, which are equal to the last day's infections added to the 7-day average rate, and the new infections, which are the rate multiplied by the previous day's infections. The SARE model can be defined as a 4-stage model which nearly every individual falls into. Susceptible applies to people who have not caught the disease but are able to become ill. Exposed refers to people who have interacted with carriers in a significant capacity, such as essential workers. Infected refers to people who can spread the disease, whether they are asymptomatic or symptomatic. And recovered refers to those who have recovered from the disease and are no longer able to spread the disease, or people who have died from the disease and are unable to spread the disease. The methodology, the research comes from Our World in Data, which cites its data from Johns Hopkins as well as the United Nations. 5 countries were selected: Italy, Canada, the United States, Japan, and the United Kingdom. Italy had a very high initial breakout, which leads to a very high R null value. Canada is very similar demographically to the United States, but had very different mitigating actions, which can be used to compare the effects of mitigating actions. The United Kingdom had similar behaviors in response to the pandemic, so there's an exploration of the similar mitigating actions but different demographics. And Japan had both different mitigating actions and very different demographics. China was excluded from the data because of possible incongruities with the data accuracy. Models for the early stage outbreak were created, which are the R infection rate, or the R null value. Model cumulative cases and model 7-day average was calculated. The R infection rate, or the R null value, is found on a cumulative versus 7-day average data chart. The model cumulative is the same as the initial outbreak patients, and then the previous day plus model 7-day average. And the model 7-day average is current day times R infection rate. Continuing methodology, the R over R null graphs were created to find the date of significant decreases in cases, where R over R null curves show the point where mitigating actions reduce the growth of the pandemic from the initial model, and cases over test curves were created, which were averaged in order to apply weekly fluctuations. And cases over test should consistently be below 1. If the R cases over tests value is too large, it means that under-testing is occurring. This is how R null is found. It's an initial exponential growth over the first couple of weeks of the outbreak, before mitigating actions were taken and before there is significant awareness of the pandemic. Logarithmic scales are applied in order to make a linear graph, and the M value is the R null. The cumulative over 7-day makes it so that the population density is somewhat normalized. Mitigation reduces the rate to an R that is smaller than the R null. R over R null curves show how large the current rate is over the rate at the beginning of the pandemic. Once it reaches approximately 0, about 0.01, that's the point at which mitigating actions have fully taken effect. With some countries such as Canada and Japan, there is a double peak where mitigation efforts were relaxed. This is very obvious with Canada, where the line goes down and then jumps back up, creating a very late peak. The initial R nulls show how much how many people would have been infected by a carrier at the beginning of the pandemic. The global average is around 0.2. Fraction of positive cases has decreased the ratio over time as countries ramp up testing, but recently the United States, which is the yellow line, has not kept up with the disease. The testing has grown larger according to this model. This is data showing the cases over population rate as well as the cases over test rate as of the middle of July, as well as population size. And there are also significant dates of mitigation. It's very important to note that mitigation efforts, especially state of emergency declaration, coincide with a lessening of the R over R null curve. In conclusion, the R over R null curve finds normalized state of mitigation, and the model predicts larger amounts of infection than in actuality. The R infection rate shows how many people get infected daily from an ill person on average in early stages before mitigation measures. The cases over test curve shows whether enough tests are being implemented in certain countries. The model shows that the United States is currently under-testing at a higher rate than the other countries studied under the current model. Effective mitigation in early stages leads to earlier model breakdown. Further research would involve more countries and attempt to model further behavior of the coronavirus. Thank you.